You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, liposuction, what you need to know. With us, we have San Diego's liposuction doctor, Dr. Tirgari. Dr. Tirgari, welcome to the program.
Randy. How are you? Thanks for being here.
Good. Now, before we get into today's topic, for people that don't know you, tell us a little bit about your practice. Who's your typical patient? And, what are the different procedures that you do?
You know, we get patients from all backgrounds, all ages, men and women. It's kind of interesting to me over the years how people have started having liposuction done at a younger and younger age. In San Diego, people want to look good, and who could blame them? The sun is always shining, you're not always covered up, and so we find that people who've been exercising, have stuck to a really good diet and still cannot get those problem areas fixed, have been turning to liposuction. And it's helped them. They help them look good, feel good, and it's kind of rewarding to see the results after we're done.
So all you do is lipo?
That's all we do. That's 100% of our practice.
And so how'd you get into lipo, by the way? I've told you this on the phone, and I think patients need to know this, that most doctors, and I would say probably 90+% of doctors, plastic surgeons, cosmetic surgeons, don't like doing lipo. I try to get them on my show, and they say, Randy, I don't want to be stuck doing lipo all day. They'll do it, so why do you like it? And how'd you get involved?
I love it. My father was a plastic surgeon, and most of my family is in medicine. And physicians, they really work on things on the inside. They work on your cholesterol, they work on your blood pressure. But most of people's benefit isn't just on the inside. It's also holistic. People want to look good, not just feel good, not just have a high, not really just have a good blood pressure. And so we find over time that when we start doing liposuction and we found the results in people's overall sense of well-being, the results were actually very, very rewarding. So it's one thing to basically, fix your blood pressure numbers and so on, but it's another thing to make somebody look good. They feel better about themselves.
Did they tell you that?
All the time. All the time. And we can't stop ourselves from getting older, but what we can do is do something proactively to make us look good and feel good about ourselves.
Okay. Now, are the patients getting older and older, younger and younger that are getting lipo these days?
We get all ages. And of course, people in their 50s and 60s really start paying attention to the effects of time. But we find that people who are younger, they start wanting to look good about, feel good about themselves and look good. And so we find that when they've tried the things they should be doing, proper diet, proper exercise, yada, 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 so to speak, we find that when they turn to lipo, it's because they've exhausted other possibilities. And they say, you know what, I have this problem area, I don't like it, I don't want to have this anymore. Let's do something about it.
When should somebody get lipo? Is there a time when you should get lipo?
Generally speaking, we get clients all through the year.
And I also want to ask, when should you get lipo and who's the ideal patient? That's another one.
Most people fall in the category of the ideal patient. There's very few people that we would not recommend it to. Most people who are generally healthy are great candidates for lipo. We treat every age and every background you can imagine.
Okay. And now, what are the common areas? What are they getting?
Most commonly, people get the abdomen done. For a lot of women, the waist, the hips, those are problem areas that they've had problems with over the years. And so we find that's very, very common. Sometimes people come in for their chins or their arms. Those are less common. Generally speaking, we find the abdomen and the waist tend to be the #1 areas. Okay,
what's changed over the years? Are you better at doing lipo now? I guess doctors in general now than they were 15 years ago, and if so, why? Why are you getting better results today than you were then?
Absolutely.
And what's changed?
No question, people have come in because they've heard that liposuction has become less and less invasive. Back in the days, you basically have to go under general anesthesia, get intubated, go to an operating room, and now we don't need to do that anymore. The state of the art in liposuction is to do it all under local anesthesia. You're awake, you're listening to music. It's entirely
Sounds like painful though.
Absolutely not. There's absolutely no pain associated. People are actually sleeping on the table. We can wake them up, but they get up, they walk out, they're wearing their compressive garments. We see them the next day, they feel great, and they're back to work within a day or two, which is amazing.
Now, lipo, I guess there's like power-assisted lipo, there's laser lipo, there's a lot of different types of lipo, smart lipo, this and that. What's the best technique?
All of them use some form of tumescent liposuction, which is basically taking the body area that you're treating, for example, the abdomen, and filling it with tumescent fluid, which basically fills up the area with the lidocaine and numbing agent, makes the entire procedure painless, and then the surgeon goes in there with tiny, tiny little cannulas with tiny incisions, and either with the laser or with the power-assisted equipment, breaking up the fat and then sucking it out. So generally, they're all variations of the same thing.
Okay, and what are the frequently asked questions? So when a patient goes in, what do they ask every single time?
Is it going to hurt?
Okay.
And that was actually a good question that you asked. We get that question a lot. And once the procedure is done, clients are amazed at how little they felt during the procedure. And so that's the number one question that I think people ask me.
Okay.
The other question I usually get is, how long does it take to recover? And, when people go back to work within a day or two, they're kind of amazed at that as well. Generally, I tell people, give yourself a couple days just to be on the safe side. It's better to be on the conservative side and not take risks. But very, very few people have come back to me and said they've had any problems with going about their usual activities.
Now, is there a lot of technique to it? Because my perception going into today is everybody's doing lipo the same way.
Mm-hmm.
How much art, how much science?
Mostly art.
Really?
Mostly art. It's a misconception that liposuction is just going in there and taking out all the fat. You really have to make sure that you're artistically contouring the body according to each person's body type. Anybody can go in and poke a hole and take fat out. But I think it takes a certain amount of artistry and skill and experience to be able to make the body look proportionally attractive. And that's, I think, where most people need to know that choosing the right surgeon is the most important decision that they're going to make.
Okay, what are the fear questions that they ask? Like lumps and bumps, for example. Because I've seen, you've seen the tabloid, you see some of the celebrities that they're bumpy or whatever.
There's a time after liposuction, within the first couple of weeks, the skin is going to feel a little numb, a little irregular in some areas, and that's entirely normal. We tell people in advance, our packet of information is pretty thick, because I like for clients to be as well prepared and to anticipate as much as possible, and it minimizes anxiety. And I think that's really what stops people from getting the procedure done, is the anxiety about the uncertainty of the procedure. And I think once they come in with a very clear expectation of what they need to expect when they walk through the door, it quells that anxiety quite a bit.
Okay, so so with lipo, by the way, I mean, do you feel like you're changing people's lives?
Absolutely.
Sometimes?
No question.
Really?
No question. I've had people come back to me with their follow-up appointments, and they've literally been in tears at how happy they've been and how much it's changed their overall lifestyle.
What about arms?
Arms?
Like upper arms, what do they treat?
We do it all.
Okay. Now, so with liposuction, and I invited you to come on the show, by the way. We called you a few times. We got you to come down here. And, and I'm sure you had something in your mind you wanted to make sure, because we're almost out of time, but the main message that you wanted to get across, what maybe haven't we talked about that you wanted to talk about?
You've covered all the points. Thank you, Randy. The basic gist of it is that, people should not be afraid of taking care of themselves. The most important investment you can make is not shoes and bags and cars and things that are going to basically rot. The most important thing is yourself. You're blessed with this body you're going to have for the rest of your life. We're not getting any younger. And the most important investment I tell clients is take care of yourself. You are the most important thing that you own.
So in this economy, you say invest in yourself. Maybe get some liposuction.
Of course.
Is it still the most popular procedure?
It's definitely
of all
up
the
there.
cosmetic procedures?
I believe it still is number one.
Okay.
I may be wrong, but it's definitely been number one or number two over the past few years. And generally speaking, fear of cost is another issue that we sometimes deal with. But we offer financing, and that's one thing that's quelled a lot of anxiety for clients as well.
Now, what about men? Are men coming in? Is it mostly women?
Lots of men.
Really?
Lots of men.
And their main area is what?
Abdomen.
Abdomen. Do you do the male breast?
We haven't had that many clients come in that want to do the male breasts, and generally speaking, it's because for most of the clients that we've served, it hasn't been a problem area that we've had to deal with.
Okay. Final message, somebody considering liposuction. What do you want them to know?
If you want to look good and feel good, be proactive and take the first step. Once you've dieted and exercised and done the things that you should be doing, if you still have problem areas, give us a call and we'll be happy to take a look and see if we can help you. Okay,
and by the way, final question are there any misconceptions that people have about liposuction or the procedure itself that just aren't true, that you can lay to rest right now?
I think liposuction has become so popular that most of the old misconceptions, am I going to scar, am I going to bruise, or all those things, those are things that we get asked. We used to get asked quite a bit. We take extra precautions to minimize those risks. Knock on wood, none of our clients have ever had any serious complications at all. In fact, none of our clients have. But people do ask us, am I going to have bruising? Is it going to hurt? Is there a risk of infection? With techniques as advanced as they are today, those are almost negligible. So that's one thing that I like to advise clients, to have in hand before they consider the procedure.
And before and after photos, you have them on your website? They can visit your website. I'll put it at the bottom of the screen, but they could visit there, take a look at your work.
Absolutely.
And we'll go from there. I want to thank you so much for coming on the show.
Thank you, Randy.
Very interesting.
Thanks for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.